everyone. Let's learn about pain management. Physical therapies for pain. Surgery. Surgical internal fixation for bone metastasis is indicated for pathological fracture. Medullary lesion greater than 50% diameter of bone. Cortical lesion greater than 50% cortical width eroded. Lesions causing persistent pain after radiotherapy. Pain related to visceral obstruction. Esophageal. Laser resection, endoesophageal tube. Intestinal, bypass surgery. Colonic, bypass surgery, defunctioning colostomy. Biliary, bypass surgery, stenting. Urinary, ureteric stenting, percutaneous nephrostomy. Heat therapy. Heat therapy relieves pain as a counter-irritant and by direct effect on the tissues treated. The sensation of heat acts to reduce the transmission of pain signals in the dorsal horn of the spinal cord and may also induce inhibitory stimuli from the brain stem. The local effects of heat include muscle relaxation, increased blood flow, and tissue compliance. Heat therapy is of particular benefit in the treatment of muscle spasm, myofascial pain, and the general musculoskeletal discomfort associated with immobility and debility. Heat therapy to superficial tissues is achieved with hot packs, hot water bottles, electric heating pads, or radiant heat lamps. Heating of deeper tissues may be achieved with ultrasound, shortwave diathermy, and microwave treatment. Heat therapy can cause tissue damage and should not be used near metal or plastic prosthesis or areas where bone cement has been used. In areas where there is diminished sensation or paralysis or where tissues are ischemic, where there is infection, directly over tumor tissue. Electrical therapy. Transcutaneous electrical nerve stimulation involves electrical stimulation of nerves using electrodes applied to the skin. Causes electrical activity in the large afferent fibers that override pain signals in the dorsal horn or the spinal cord. Electrode placement and choice of frequency and intensity of stimulation should be performed by an experienced operator. Optimal settings are different for each patient. When operating, TENS produces paresthesia in the painful area. Electrical therapy is useful in treating mild to moderate musculoskeletal pain but is ineffective against visceral pain. It is contraindicated in patients with a cardiac pacemaker. Results in a high initial response rate, although only 15 to 20% of patients will obtain long-term benefit. If successful, it will reduce the requirement for systemic analgesics and has the advantages of being cheap, easy to use, and relatively free of complications. Topical counter-irritants act by stimulating neuronal activity that inhibits the passage of pain signals in the dorsal horn of the spinal cord. Heat and cold therapy and massage relieve pain by counter-irritation. Some commercially available analgesic ointments work in the same way. Capsaicin cream causes transient burning or stinging and may act partly by counter-irritation. Acupuncture. Acupuncture is used to relieve pain by mechanisms that are incompletely understood. Acupuncture involves needle insertion at classical acupuncture points or in painful areas. Its role in the treatment of pain in the palliative care setting is not defined. It is relatively cheap and safe and if successful will reduce the requirement for systemic analgesics. Mechanical therapies. Massage. Massage can relieve pain due to muscle spasm, myofascial syndromes, or the general musculoskeletal discomfort associated with immobility and debility. Exercise. Passive and active exercises may improve pain control and lessen the general musculoskeletal discomfort associated with inactivity or debility. Hydrotherapy is particularly useful for patients with pain related to weight bearing. Manipulation. Physical manipulation by chiropractors, osteopaths, and physiotherapists is the most commonly practiced treatment for non-malignant back pain. Patients with cancer often seek such treatment, but manipulation should be performed with great care in the presence of vertebral metastasis. Orthotic devices. Braces and supporting devices will relieve and prevent pain, but stabilizing or immobilizing painful tissues are of particular benefit for pain related to movement and weight bearing. Mechanical therapies, mobility aids, walking sticks, crutches, and walking frames are of value in preventing pain associated with movement and walking. Immobilization. Patients suffering severe pain despite the use of optimal analgesia and the physical supports described above may be forced to accept the use of a wheelchair or bed rest. Thank you, my friends.